Good morning. As of yesterday, the city has 8,074 reported cases, 122 people hospitalized with COVID-19, and 339 deaths. I'm up here every week to ensure our residents have the most up-to-date and accurate information so they in turn can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in the city of Baltimore. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptom screening and to be connected to a physician for assessment. I also want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov. Today, I'm excited to announce a new partnership with the Baltimore City Health Department, Johns Hopkins Medicine, University of Maryland Medical Center, and BUILD to increase access to mobile on-demand testing for COVID-19. This partnership will help us increase testing availability for our residents across the city and reduce barriers we know our residents have experienced. The Baltimore City Health Department's testing site at Pimlico Racecourse, operated in conjunction with the Maryland Department of Health, allow residents to schedule appointments online without a referral. While an appointment is strongly encouraged, residents can also access testing without an appointment, as long as supplies are available. Testing at Pimlico occurs on Tuesdays and Thursdays, weather permitting. I want to thank the Health Commissioner and our partners, Nikki McCain, representing Johns Hopkins Medicine, and Dana Farrakhan, representing the University of Maryland Medical Center, for their efforts in setting up this partnership. We need residents to continue the mitigating efforts to help ensure that the trend experienced elsewhere across the country are not felt here in Baltimore City. And again, I want to thank the majority of Baltimoreans who have heeded the warning and followed the guidance. We will continue to monitor the data daily. Now I will ask Baltimore City Health Commissioner Letitia DeRosa to update you on our COVID-19 response and how you can continue to protect yourself and your loved ones from COVID-19.
Thank you, Mayor Young, for your support and leadership during these difficult times. Last week, Baltimore City averaged approximately 1,500 tests per day with an overall positivity rate of 10.6% and a weekly positivity rate of 5.3%. Then and now, I want to remind residents to remain vigilant as there are zip codes in the city with positivity rates above 20%. This serves as a stark reminder that this pandemic persists and continues to pose a threat to the health and well-being of every city resident, but it also reminds us that this pandemic is affecting some communities more than others. Today, I'm pleased to stand with our partners from the University of Maryland Medical System, Johns Hopkins Hospital System, or Health System, and BUILD as we announce efforts to increase the number of mobile community-based COVID-19 testing sites around Baltimore City. These new sites will be deployed specifically to areas that are hardest hit by the coronavirus pandemic in an effort to decrease the positivity rate in those communities and provide direct services and information to those who need it most. Our goal with these new mobile testing sites is to make it easier for residents without access to a car to find safe, reliable testing services in their own neighborhood. These new mobile sites will be going online next week, and I would encourage Baltimore City residents in need of more immediate testing to take advantage of the Baltimore City Health Department's testing sites operating today, as Mayor Young mentioned, at Pimlico Racetrack, and also at La Iglesia de la Resurrección at 2900 East Fayette Street until 12 p.m. today. Additionally, on Friday, the Baltimore City Convention Center will be performing tests from 8 a.m. to 2 p.m. More information on these and other testing sites across the city can be found on our website, coronavirus.baltimorecity.gov, as well as on our social media. Beginning next week, we will be updating all of our media platforms to include the new testing site locations as well as ours. Our local COVID-19 case data, similar to findings in other jurisdictions around the country, indicate that our African American and Latinx populations are disproportionately bearing the brunt of the coronavirus pandemic. Our country's history of racism, the community's medical mistrust, and a combination of societal as well as environmental factors, collectively known as the social determinants of health, all play a role in the disparities we are seeing in case numbers. Additionally, The coronavirus pandemic has exposed specific fault lines in our economy that allow the virus to flourish in some populations more than others. We know that our Black and brown communities are less likely to have jobs that allow them to telework, more likely to have jobs that are considered essential, and less likely to be able to safely isolate at home due to crowded, blended, or multi-generational households. I urge all Baltimore City residents with coronavirus or anyone who may have been exposed to someone with coronavirus and who may have trouble safely isolating at home to take advantage of our triage, respite, and isolation site or our Tri-Center at the Lord Baltimore Hotel. Qualified residents will be offered free room and board for the duration of their stay in isolation or quarantine. Residents will also have access to a multidisciplinary team that will ensure resident safety and care coordination while they recuperate and recover. Individuals looking to see if they or a family member qualify to stay at the Tri-Center should call 443-984-8915. Again, that number is 443-984-8915. Someone is available 7 days a week from 8 a.m. to 7 p.m. to do intake, or you can find out more at our website, coronavirus.baltimorecity.gov. As a reminder, wearing a mask or a face cloth covering remains one of the most important things individuals can do to limit the spread of disease as they go out into public. Wearing your face mask or cloth covering so that it covers both your nose and your mouth is the appropriate way to wear a mask. If you are only wearing a face mask to cover your mouth, you are not providing the optimal protection for your family, friends, or others that you meet. Please wear your face mask properly, covering both your nose and your mouth when you are out in public spaces and socially distancing is challenging. Thank you.
Thank you. Finally, I want to let residents know that yesterday the city, along with the Department of Transportation and the Parking Authority of Baltimore City, announced that parking meter enforcement will resume on Monday, July the 13th. Again, starting on Monday, meters will be enforced and people should follow the posted time limits and hours of operation. And motorists should not park at any meters which are bagged or inoperable. And now we'll take a few questions.
Well, Mayor, my question is actually unrelated to the COVID. I wanted to know if you
I
have
can't
any plans.
understand you.
I'm sorry.
Yeah.
Wanted to know if you have any plans in place to protect the Christopher Columbus statue, as you know, that was recently torn down, and also the FOP Memorial just across the street from us. As you know, there's some on City Council who are calling to have it removed because of its association with the police union. Any thoughts on that, and if there's any plans in place?
Well, my thoughts on all of this is there's no way you can, erase history. You learn from it. And those monuments should have something there to talk about what happened in the dark past, because you just cannot erase history. And for those who want to destroy property and things of that nature, it's not going to be tolerated. And when we find out who destroyed those statues, they will be held accountable. You just can't go around. Now, we support peaceful protests. This is not a peaceful protest. Destruction of property is just unacceptable. And those who have destroyed those statues, if we identify them, they will be brought to justice. And I'll leave it at that.
Mayor, on that, just one more on that topic. First it was the Rawlings-Blake administration, and then the Pugh administration, of course, took down the Confederate monuments. Is there any talk of forming a new commission on my understanding is there are about 20 to 25 contested monuments or structures around the city. Is there any talk about putting it in place?
I would defer to the next administration.
One other question, COVID related. The use of the Lord Baltimore Hotel as a isolation point, I guess for lack of a better term, how long can the city afford to do that?
As long as we can get COVID funding. All this is a part of the COVID funding package that they're giving to cities around the country. But I'll let Dr. DeVasa, if you want to expound on that, she can come up and do that.
Yeah, so again, we think this is such an important resource for individuals who can't safely isolate, and we'd like to continue it for the next few months. Originally, the contract was looking at least through October. Certainly, we recognize that the pandemic will go on past October, but at least for right now, at least through October.
How many people use it on an average day?
Yeah, so we've seen anywhere from about 20 to 50 folks, 50 being our high, but it fluctuates depending on intake.
Thank you.
And this might be a little bit more for the director. Could you expound a little bit more on the targeted testing areas that you were talking about in terms of this COVID testing? Because I spoke with Build and they were talking about 21224 as one of those targeted areas.
Yeah, 21224 remains the zip code with the highest positivity rate in the city. And so that continues to be an area that we're focused on. And as we talked about today, our partnership with Hopkins will allow us to have an additional mobile testing site there. So the testing site that launched today at La Iglesia de la Resurrección, that is our first time being at that location. But Hopkins has also been supporting with mobile testing site in that zip code as well. Additionally, we'll be partnering with Maryland to look at zip codes on the west side of the city that have higher positivity rates too.